that we presented at Pacific College. As I mentioned in the email that you probably got, today's master was at the first Pacific Symposium in 1989, if you can believe that.
79.
89.
89? No, not, oh, you're right.
Jake, we're old, but not that old. Don't make me feel any older than I am. And he's been at many since then. He was the author of what was essentially the first American physician's desk reference, shall we say, for Chinese medicine. It was called The Essentials of Chinese Herbal Patent Medicines. And he followed that up with Essentials of Chinese Formulas and co-authored TCM Case Studies on autoimmune diseases. And you might enjoy a more personal conversation with Jake and myself at Pacific College's podcast station that you can find at pacificcollege.edu. How today's session is going to work is same as the last one, is that Jake will present a case study and he will present the signs and symptoms. He'll then offer you a moment or two to post in the chat box some questions that you might have about the case that he didn't present, other information that you might imagine needed from the patient. Then he'll continue on and challenge you to guess the diagnosis for the patient. And then as a finishing, he'll present his diagnosis, his rationale, his treatment. That's worked really great in the past. So without further ado, I'd like to introduce you all to Dr. Jake Fratkin.
Okay, thank you, Jack. Thanks for inviting me. I'm surprised to be the third invite, so I'm happy about that. So everybody out there, we're live now on April 2nd, 2020. You might see this sometime later, but we're right in the beginning of the severity of the COVID's 2019 epidemic. If you're watching live, you all know what I'm talking about. If it's 6 months from now, hopefully it's coming to a conclusion. But today's case presentation is very different than something I would have done a month ago or 2 months ago. 2 months ago, we would have worked with a case and talk about all the interview we did and the history and the signs and symptoms, pulses and tongues. And then we would have tried to make that into a differentiation or two within traditional Zongfu organization. But today is very different. And why is it different? The main reason it's different is because the cases we're treating right now are on the telephone. They're not in person. We don't get to feel the pulse. We don't get to see the tongue. We don't even get to see the person unless we do a phone consultation on Zoom or on Skype or FaceTime, something like that, which actually is very helpful, but it's not the same as touching or feeling the person. So we're in a different time. Anybody that's going to be able to keep a practice going right now, it's because they're doing it by telephone consultations. And so I have adjusted my presentation to address that. How do we work up a patient over the phone where we don't do pulses and tongue and so on? And also we're in the middle of the COVID infection, the pandemic. So it really started to crank up for us clinically, not until March 15th, which is only 2 weeks ago. The world has changed a lot in 2 weeks. We've been shut down. Acupuncturists aren't allowed to touch patients anymore. Everybody's got a stay home directive. It's a very different world we're living in. As far as the number of COVID cases, it's a fraction of what it's going to be in 2 weeks or 4 weeks. So by the middle and end of April, it's really going to be popping. And it'll go through May for sure. So I think now's a good time to talk about how to treat COVIDs. John Chen just gave an excellent lecture here for Pacific just last week, and I'm sure that's on recording either through Pacific or through John's organization, eLotus, that lectures, and they're very worthwhile because John's lectures are based on information from China, which I am also privy to and which we're going to talk about also. But it's a whole new world out there. And this COVID's is much more contagious than people thought. First, they thought, someone had to be in your face, and they said 3 feet apart. Then they changed that to 6 feet apart. Now they're changing it to 9 feet apart. There's a wonderful little video that came out of Japan just a couple of days ago of a scientist who used laser tracking to show about respiratory droplets and how far they go. And then he identified what he calls micro droplets. Really, they're so light, they don't drop in the weight, and they'll just hang. So if 2 people are talking, it'll just hang in the air and never go anywhere unless there's ventilation. He's recommending that 2 windows should be open for any indoor conversation. But these microparticles, they just stay in the air. And this is why many more people are infected that know they're infected. Many more people are spreading the virus that know they are spreading the virus. So my own feeling is this COVID will not be over until everybody has been either personally infected themselves with a mild or severe case or obtained a vaccine. So this is going to be like smallpox. It's the vaccine that's going to bring this to a conclusion. But a vaccine is a year out. So only 20% of COVIDs is ending up in the hospitals, and only less than 5% of those are actually dying. These are people who need ventilators. But 5% need ventilators, and as of this time, there aren't enough ventilators. But those are hospital-level interventions that are going to survive or not based on that ventilator. But 80% of people really don't have to go to the hospital. So they're going to be at home to various stages of sickness. I would say that probably 25% of those people have no symptoms. They absolutely have no symptoms. And some will be mildly sick and some will be very sick. Now, fortunately, this virus started in China. And I say fortunate because they have the opportunity there to use very senior Chinese doctors, best herbalists in the world, give their 2 cents on how to treat this. And they've been treating it since January. So a lot of very experienced doctors have come out with their recommendations, which fortunately we have access to and can follow. Okay, so these are general comments about the virus. Now, if you're a good doctor, you're already following in the news, you're already following what's happening. But it's like the SARS virus, it's a coronavirus, and we have the experience of what happened in SARS in 2003. We have the experience of what happened with swine flu in 2008. And so we're not coming into this blind. We're pretty prepared. Now, the real question that I don't have the answer to is how successful is the herbal approach for these people? We don't know yet. We just don't know yet. I have not treated any advanced stages. I have not seen the lung fire stage or systemic toxic heat stage. I've only seen early stage. But that's today, 3 days, that could totally change. It's really going fast. The notes to my handout can be found here, and you should write this down because you can't, I don't think, maybe Jack can download it later, but it says tinyurl.com/WN8DT7E. Maybe Jack will copy that and provide that for everybody on the chat room. Or maybe I could do it. Can I type something? I can do that. tinyurl.com/WN8DT7E. Okay, I got that. That works. That's for all the notes. That's the handout notes. That's very convenient. Okay, so just last week, or it's been, we'll go into the dates, but there's 2 cases of early corona infection. Actually, it was a mother and a daughter. I treated the daughter, and then 2 days later, her mother called and said, well, I'm having the same symptoms as my daughter. So now I can manage 2 cases, but they're actually very similar. Let's see. Okay, this was case 1, 46-year-old woman. Her name is Kate. We're calling her Kate T, period, age 46. This was a telephone consultation. She's a professional singer, professional songwriter. She leads her church choir every Sunday which is a very important part of her life. I've been treating her on and off since February 2018 for multiple complaints. She has a history of asthma with flare-ups. She uses Nasacort and albuterol as needed. She also has a significant PTSD situation from a childhood experience. I was also treating her for frequent ovarian cysts with concurrent dysmenorrhea and PMS, frequent urinary tract infections. She has other problems, digestive and neuropathies, low energy, sleeps poor. On February 10th, I didn't treat her then. She reported that on February 10th, she had the real flu for 3 days. And this, by February 20th, this went into a sinus infection. She called me at that time, not the first time, and by phone, and I just told her to take methylene. This is a 7-Forest product for sinus infection, which I like a lot. I think it's strong. And she said she never truly recovered. She didn't follow up with me. She's very erratic about her appointments. But now when she was calling, she was concerned. This was on March 23rd, so this is 10 days ago. She had a low-grade fever. Now her normal fever is 97.1 to 97.4. Now it's 99.1. A lot of people now have lower normal temperatures. It used to be 98.6. Now it's like, 97.6 is more common. A lot of this, I think, is from environmental chemicals that are affecting the thyroid. So a lot of people are going into a subclinical hypothyroid situation. She said she was achy for 2 days, several days of dry cough, difficulty getting full breath, tightness in the chest, slight amount of phlegm. Now, for me, these were alerts to the coronavirus. Something I read today in the medical literature said, if it looks like corona, treat it like corona. We don't have any tests. Unlike Germany and more sophisticated countries, we don't have any tests. And so they're saying you have to assume if it looks like corona, it's corona. And I'm looking at her symptoms and I'm going, this is corona. This is it. This is the first stage. So from this and from talking to her, I had enough information to move forward. But what would you do? Are there any questions you would want to do to confirm the corona, or just keep it as a regular cough? Let's see if there's some questions on the chat room. Okay. Any questions? Tongue. Yes, you can look at the tongue, but I didn't have a camera, so I didn't look at the tongue. So we're making these diagnoses. Incidentally, I studied for about a year in China back in the 80s in hospitals, and very few doctors paid attention to tongue and pulse. I got to tell you, this is the truth. They operated, because they were seeing so many patients in a short time, they were operating much more from their clinical history. And the clinical questions and answers actually made the lion's share of their diagnosis rather than pulses and tongue. I just put that out there. Okay, so we have some good chat room questions coming up here. I won't be able to do them all, but let's see what people say. Inhalation or exhalation worsen asthma? I don't know. If I go back to her original notes, which I have in front of me, her asthma, she had a very traumatic birth where her son actually had a stroke in utero at the time of delivery, and we started treating her for recovery from that. She also had swine flu during her pregnancy, and her kid had a stroke. It was a terrible thing. Kid's fine now, by the way. She actually, okay. But her original asthma, I don't have much. On that first visit, it was nothing about the asthma.
Jake, folks are asking any loss of smell or taste, which is a common precursor, any known contact with a carrier.
Yeah, she definitely had loss of her sense of smell and taste. Definitely changed on this March 23rd visit. You know, chest X-ray, no. Do we need to contact known carriers? I don't know if we need to, but it wasn't done. Lung symptoms are typically the second stage. Well, yes and no. When you want to look at first stage of corona, basically it's the symptoms she's presenting. The tightness of the chest seems to be very common. There's a sense of pressure on the chest, maybe inhibited breathing, inhibited inspiration capacity, slight cough. Now the cough comes and goes, and it can be just like a tickle, or it could be more severe. But in the beginning, it's just a very slight cough, chest compression. May or may not have sore throat. She did not. May have loss of smell. She did. You know why you lose smell? Because of the virus. Because of the virus. The Japanese are advocating people to do nasal irrigation 3 times a day because they think that's the first root of the infection. And so that loss of smell is up in the sinuses. So nasal washing with Neilmed. My friend Jeffrey Dent said, well, actually, he's putting iodine in there. You could put Chinese herbs in there. You can use different, antibacterial, antimicrobial nasal sprays like colloidal silver and so on. So lung symptoms, when I say first stage, I would put it in the first stage. Now, there's a prevention stage where you don't want to get sick, and that's a different matter. But when they start to present, I think lung symptoms start up pretty quickly, or right there. Where has she been? Any reason to suspect exposure? She had not been anywhere. She's a mother of 2 children, and she hasn't been anywhere. She's just been in the neighborhood. Was she achy all over? The achiness, her achiness was back of the neck and her shoulders most noticeably, upper back, when she started. She did have some headaches. In fact, headache was actually her first symptom. Sleep emotional, her sleep is always disturbed, and she's always emotional. So, it's a pre-existing condition. She's a very, because of her PTSD, she's a stressed person. She lives in a stressed state, although she really does a lot to mitigate that and take care of herself. Any color to the phlegm. She was not expectorating the phlegm. There was never any expectoration at the stages, at this time that I've been treating her.
Any digestive digestive symptoms, Jake? Someone else has asked.
Before that, is that above or below?
I don't know where you are. Chriso has asked, any digestive issues since COVID can affect her gut?
She did not. That's a very good question, because for some people, digestive symptoms are more predominant. They would be cramping, perhaps gurgling, loose stools or erratic stools. And China noticed this too in Wuhan, that it was either upper respiratory dominant or digestive dominant. Now, because Wuhan is a very, very damp place, and we saw this in SARS back in 2003, a lot of people had digestive symptoms. And so the formulas were adjusted for spleen dampness as opposed to lung heat and dryness. And they really had 2 formulas. One for corona, they have 2 early stage formulas. One's for lung heat and dryness, and the other's for spleen dampness. But those questions are good. Any color to the phlegm? No. But I would think at this stage, the phlegm would not be particularly yellow. That happens as heat develops. As heat develops in the lungs, then it's more and more phlegm. But, I know a lot more about the SARS epidemic than about the corona, because we have a lot more information from then. And as the heat in the lungs develops, the phlegm becomes more and more sticky and very difficult to expectorate. So we don't ever really see the phlegm. Of course, everybody's different. In some cases, you're going to see phlegm. But when the phlegm's yellow, there's heat. But you can tell there's heat if the cough is harsh. If they have a harsh, recent cough, there's usually heat. And then the question is how much heat. So the more the lungs hurt, the more the heat is. And of course, then the tongue becomes important to look at. But I don't think you're going to need tongue, or phlegm to know there's heat in the lung. Body aches, she had body aches, but not that much. She said it was doable. Do we know it's content? We did that. Fatigue, she definitely had fatigue. Definitely had fatigue. So it started with headache, fatigue, then it was achiness in the back of in the trapezius, and then her lungs started to feel pressure. No night sweats. She did not mention chills. I asked her, because a lot of these people in the early stage will alternate fever and chills, which is why they're seeing it as a Xiaoyang presentation rather than a Taiyang presentation. You mentioned her affiliation with her choir. By chance, had she been to church between the first bout and now? By first bout, you mean her first contact with me? No, they stopped. In Colorado, they stopped church services about when? Around the 15th, 2 weeks ago. So the 15th, maybe? Around the 15th, around March 15th, they basically started to put it into process of shutdown, and all the churches stopped. So I'm sure she had it before. The question is, a week before the onset, was she at church? Well, sure. I mean, at this stage, I think, identifying is good, but so many people are carriers or going to be carriers that the best thing you can do for everybody is self-containment is the best course of action. Is everybody should just not touch or be near other people. You mentioned affiliation, smell loss, yes. History of asthma, yes. I mean, her asthma was a big part of her life. And we have been treating it off and on, not off and on, but since I've been treating her recently, we've definitely been addressing the asthma. Is she able to sweat? Don't know. I did ask her, was she sweating? And she said no, but I don't know if she was not able to sweat. Any digestive issues since COVID can affect the gut? Yes, she had nausea. She had some nausea. Oh no, wait a second. Can't read my handwriting. I said no nausea, because nausea is definitely a part of the spleen damp presentation. No nausea. I have concerns our profession not being linked into the public health system. COVID is a reportable illness, folks. Even if not tested, confirmed, we should try to get them tested and report suspicious cases. Well, I agree with that. I agree with that, but we don't have test kits. We don't have test kits. Europe has been able to get this under control because of test kits. 6 weeks ago, Germany offered thousands of test kits to America, and the Trump administration, and I don't mind disparaging his name, turned them down. No, we don't want anything foreign. We'll do it all ourselves. Well, he didn't do anything. He didn't do anything. So while Europe and South Korea and Japan have been way ahead of the game in test cases and isolation, and they would then, if they tested, then they would be very proactive about identifying contacts and so on. But as far as reporting, without a test kit, what's to report? The hospitals, at least in Colorado, don't want people coming unless they're very, very sick. They're saying, if you think you have it, stay home and live through it. Headache location, I did not ask. Is this the mother or the daughter? This is the daughter. Kate is the 42-year-old daughter. Tongue coat, don't know. Sore throat, slight. She had a slight sore throat. Would the sticky, hard to expectorate phlegm be a differentiation from bronchitis? This is a very good question, because people get coughs. People get common cold. People get the flu. How do we know if it's that or if it's corona? The only way they know is with a test kit. So I am following the recent advice, which is if it looks like corona, treat it like corona. Now, our idea of treating it like corona is actually treating the stage. The Western medicine, what do? They tell you to go home, and if you can't breathe, come back. So, but here's the difference. We would treat it almost the same, the cough, whether it was a regular gonmal, common cold, bronchitis, or if it was corona, we would treat it the same by the presentation of the cough. On my website, I have an article called The 7 Stages of an Acute Cough, of different stages with different medicines to address it. You can look at it at my website. Is it possible for all to use panelists and attendees? I don't know what that means. I have treated for the first.
Everybody knows what that means, Jake. It's when they're typing in, you have a choice to send the message to everybody or just individuals. And so everybody should post so that everybody can see their post. Yeah.
Got it.
Yeah, got it.
A good one from Amy. She says, I have treated patients whose first symptom is a chill that shakes their body. Yes, this is like Xiaoyang. This is Xiaoyang moving into Yang Ming. In Xiaoyang, there's alternating chills and fever. In the flu, the key elements of a flu is chills and fever. Usually the fever is going higher and higher. I consider typical fever and flu to be around 103, 103.5. So it's a good point, because at the early stages, we're treating it as a Xiaoyang. Now, later on, we're going to treat it as a Yangming with fever, but that comes after the Xiaoyang. All right. Okay, so a lot of people are seeing chills first. Well, I would definitely accept that as an early symptom. The question is, are they chills alternating with fever or not? In the chill stage only, with no big elevation of fever, I think we treat it as a Xiaoyang stage. And what we're seeing from China is Chai Hu Tang, which with wind heat herbs being used in that very early stage. Wind heat herbs like Gugen and Guizhi. In China, they're using Ma Huang. They're loving Ma Huang. Unfortunately, they don't let us have Ma Huang here. Time to move along. Okay, Jack says time to move along. Yeah, okay, moving along. Jack says time to move along. Okay, so.
Thanks, Nick.
No, you're right. I assume, all right, case 2, before I get to what we did, I just want to point out that her mother, 72 years old, called. She has 4 grown children. I had treated her previously for a cyst in her jaw with related TMJ. This is all from her original work up in May of 2019, where you can look at that on your own. Just other stuff I treated her for from the initial intake, which due to time, I'm not going to go into. We're just going to work with what's going on now. She called by telephone, concerned because I had treated her daughter 2 days before with the same symptoms of COVIDs, not COVIDs, COVIDs. And she and the daughter think she's presenting in a similar way. Her normal temperature is 97. She was reporting a temperature of 99.3. Then it dropped to 98. She does not feel feverish, but her face is flush. Her voice was very raspy, meaning a lot of heat in her throat. She had postnasal drip. She had a tightness in her chest. She had dry cough with a dry throat. Cough is slight, not often. No muscle aches, no headache, no sore throat. 2 weeks ago, she was in an airport. She was trying to keep a safe distance, but she really thinks she caught it from her daughter. She's been taking Immune Plus. This is a formula of mine that I produced based on the SARS formulas from 2003 as a preventative. We sold out. We sell this stuff commercially, and we sold out a couple weeks ago to practitioners. But the formula, you can look at it, and you're welcome to copy it. It's part of what we're doing. This is the Immune Plus formula, okay? This came from my formulas. And this is what people were recommended to take in China. So you see it has Huangqi, Taizishen, Fangfeng. The dispersing wind heat was basically just the Fangfeng. Then we had heat toxin herbs. We had Lianxiao and Banlangan. For all cases in China were treated with Huoxiang because it felt like digestion was going to get stagnant. There was going to be stagnation in the digestive tract with accumulation of dampness. Juhua was the other wind heat herb used in that formula. Okay, now, people call in and you're thinking, what should I do? Well, there are two very good references that I go to and that I think you should go to. China has published guidelines for how to treat COVID-19 with a 146-page document called Guidance for Coronavirus Treatment. Now, you can get that here from this URL here, which I will cut and paste. And let's see if I can write this in.
So Jake, you'll need to change who you're sending it to as well. So you want it, it says to, you want it to say all panelists and attendees.
Yeah, this was the oops, yeah. Okay, that's for the guidance for the virus, 146 documents.
So Jake, it only went to all panelists. It needs to say all panelists.
I'm
and
sorry.
attendees.
Yeah, my bad. I see what you're saying. So all panelists and attendees. Got it. All right.
There you go.
Okay. So this is a 146-page document, half of which is Western medicine treatments. This is a treatment for Western doctors and TCM doctors. So they give, what's interesting is equal time. They give all the medical interventions and then all the TCM interventions, plus very good material on its origins, its spread, it's all that. It's a really great document, very readable. So that you want to see. And then the other document is John Chen's document called How COVID-19 is Currently Treated in China with TCM. This document is available from eLotus. It's also the basis of what John's teaching on his webinars, including Pacific. He did that. He translated it with Lori Shu. Okay. So those are the two documents you want to get. The COVID document is eLotus. Now remember, you can download my notes and you'll see this on there also. Okay. Now in the guidance, they divided certain periods. They called the medical observation period, where it's the sort of the pre-prodromal presentations. The first one is fatigue with GI upset, and the other is fatigue with fever. And those formulas, if you go to my website, I had done a presentation for AAC, Acupuncture Council of America or whatever, American Acupuncture Council, and we did, I made a document for that, and that is on my website, and the splash page will be on the lower right. And we actually go through these formulas. I sum them up. Now, this is very interesting. They said for confirmed and highly suspected cases, we want you to use this lung clearing and detoxification soup. And they said they give this middle stage, early stage, middle stage, severe cases. They want to give everybody this soup, but then adjusted for whatever other stage they're on. It's basically kind of a Shaoyang wind dispersing approach. And we're going to talk about that. As a foundation formula. Then they have also in that document and on my document on my website, the mild and early stages, they divide into two types: cold dampness stagnating the lungs and damp heat with accumulating in the lung. Then there's a middle stage, damp toxin stagnating lung, cold dampness. Okay. And then a severe stage, lung blocked by epidemic toxin, and then flaring heat in the qi and the yin. The flaring heat stage, they're in the hospital. They can't breathe. The lung blocked by epidemic toxin, I think we acupuncturists, if you get patients to call you on the phone, we're going to see a lot of this stage. This is high fever, lung fire, you know, and that has a lot more antiviral herbs, a lot more herbs that clear heat toxins. In the early stages, it was felt if you give too many of those herbs, you can cause stagnation of the progression of the qi and not be doing a great thing. But later on, when you really have lung fire, you really have to attack as much virus as you can. Then there's a critical stage, that's the ventilator stage. Okay. All right. People probably for antifungal toxin like genuine. Qingfei Baidu, yeah, okay. All right, in John Shen's document, he describes a prevention phase, an influenza phase, a pneumonia phase, a recovery phase, and he gives relevant formulas. You can get that from his material. Pneumonia stage, same thing. Four formulas for the pneumonia. This fourth one is you're in the hospital. So the first three are of interest. This is if you custom prescribe. If you don't custom prescribe, you're going to have to default to products. And there our choices become more limited. Now, this was the original lung clearing and detoxification soup. They want to give to everybody. It's not just on this page. It's a big formula. It's huge. It's got 22 herbs. Now, I never give 22 herbs. In China, they can do that because they're giving it by decoction, and they don't care. They'll throw another herb at full strength into the pot. They don't care. 22 herbs, they don't care. But if you're like me, I'm working with single herb extract granules, and I will limit my herbs to 10 or 12 herbs, no more than 12, because it's just too little dosage of a particular herb. So you have to choose your herbs much more carefully. And so 10 or 12 is what I recommend. So I took 10 or 12 out of these herbs. If you're going to do it with product, well, one approach is Xiao Chai Hu Tong with San Ren Tong is one approach to that, this early stage. So it's basically we're clearing heat in the lungs, but we're also clearing a lot of dampness. So this was a double doozy because in China, there's a lot of cases with dampness. I think here in America, it's going to be more regional. Where I live in the Southwest, dryness, it's more dry and there's not that much damp. If you're in the Northwest or the Northeast or the Southeast, you're obviously going to get a lot more dampness. So, so what I did is I modified it. I just reduced it to what I need in my area to these herbs. So we have sort of a Xiao Chai Hu Tong foundation, Chai Hu Ban Chia, Huangqin as a foundation. We have some, they wanted a federal Ma Huang. We no can do. So I'm using Cinema Guager. And then just for heat is Huangqin. Now, a lot of times, actually, if I really think the virus is increasing as measured by increased fever, I will combine a product like Ganmaling or Zhongganling as antivirals. Here's a cold damp formula. You can combine Huoxiang Zhengqi and then Jingfang Baidu as a suitable product substitution. This is for, now you have nausea, you have discomfort digestively, you may or may not have loose stools, but your digestion hurts. Your lungs are also taken, but not as much, because we are treating lungs here with Sinantium Baiqian and Xingren and Shigao. We're definitely treating the lungs, but a lot of it is addressed towards spleen dampness. It's a big formula, okay? And then these are these other formulas that you can look at. Now, as the virus increases, I like to put in formulas that are antiviral. All these are products, but not as standalone and not in the too early stage unless they're really having fever or a lot of heat in their lungs. So Wu Wei Xiao Du Yin, it's available from these companies. Chuan Xinlian, I love this formula. It's a great antiviral formula. Ganmaling, which is a great formula. Ganmaling came on the scene in 1988 with two herbs from Taiwan that hitherto had never been in the Chinese Materia Medicas. And they're very strong herbs for flu, for colds caused by viruses. Now, coronaviruses are very similar to the common cold viruses, very similar to the flu viruses. So these anti-flu herbs, I think, are very good. So you introduce them as need. You just don't depend on them. That's the ingredients. It's Gangmei Gun, it's an ilex herb, and Sanchaku. These are these two new herbs. It's an Evodia, but it's a cooling Evodia. It's not the warm Evodia like what is it, Wujuyu. Vitex, Mujinye, Juhua, Banlangan, and Jininhua. That's a God-melting formula, but 50% of it is these two herbs from Taiwan. There's Zhongganling is another good one. It uses Maodongqing as the main antiviral with Gugen, Verbania, Mabianzao, Malankan. You see a lot of strong heat toxin herbs. Qinghao is also into it. It's ironic that Western people are looking at the Qinghao, the synthetic Qinghao, or the Qinghao extract that's making it into the medicine people are looking for. But Zhongganling is also a very good formula.
Jake, there are a number of questions for about the last maybe 10 minutes or so.
Okay. You want to go ahead? Sure.
Well, it's your call, but starting maybe back with John Daniels at 11:29, don't the Wang Qi Baoju,
Okay.
you see that? Just kind of scroll through some of those before we get too far
Does
ahead.
Wang Qi and Baiju make it problematic? I don't think so. I don't think so at all. Huang Qi, because I'm looking at the formulas coming from Wuhan, and they're using Huang Qi and Baiju. So, Huang Qi boosts the immune system. We don't know everything that it does, but it boosts your own immune agents. People with strong immune agents are going to do better than people with weak immune agents. So Huang Qi Baiju, this is from Yuping Fan. And I think they're good. I think they're really good. You'll see them a lot in the prevention formulas. You'll see it in the treatment formulas. I don't think it's a problem, because if you look at a 12-herb formula, Huang Qi is just one of those herbs. The question is how much percent? Well, it's never going to be more than 9% of the formula. So I think we're okay. Okay. Why do typical prevention formulas add toxin clearing herbs? Should we think of this as an integrative approach? Well, it's integrative within the TCM world. It's not integrative. We're not bringing in functional medicine or Western medicine. The main prevention formula that they offered in SARS 15 years ago, which I have in my formula, Immune Plus, used antiviral herbs. They wanted, and in this case, they wanted that in there right away. I think you have to start targeting the viruses. That's my own position. But you have to support the Ying Qi, you have to support the Wei Qi. That's why we're supporting, Baiju and Huang Qi. Integrative, no. It's what we call a modern TCM approach. This is what they do in Chinese hospitals. It's not the classical approach. Qingfei Baidu. Yeah, that's a good formula. And I talk about that in my handout for the Acupuncture Council, using these lung heat formulas. Is the Immune Plus formula based on Yuping Feng? If yes, do the other herbs help mitigate the possible hypertension caused by Yuping? I don't know. They're not in there intentionally to mitigate the hypertension. I would not worry about Huang Qi aggravating hypertension. It's just too small. It's not enough. I don't think. No, it's mitigated to help the anti-heat toxin. So the idea is you're getting heat, you're building your own Wei Qi while also knocking down viral toxins as they come in. Would you use a high dose of Shurgao in the absence of Ma Huang? You can. It depends. No, there are different functions here. The Ma Huang is to disperse the wind, disperse the pathogen. My substitution is Guizhi, cinnamon Guizhi. Now, Shurgao is for bringing down heat in either the whole Qi network or in the lungs specifically. So very different, very different. For one thing, Ma Huang's warming and Shurgao's cooling. Shurgao is the coldest substance in our materia medica. It's excellent for lung fire. It's excellent for high fever. And in soups, we use a big amount, 20, 30 grams of Shurgao. You're not going to get that in a powder. Does Huang Qi and Baiju inhibit the release of the exterior? I won't worry about it. In Yuping Feng, what do you have? You have Fang Feng. You're trying to build the Wei Qi in the exterior. So you take Fang Feng to get it out to the exterior, and then you have Huang Qi Baiju to make the Wei Qi. Huang Qi is making the Wei Qi, and Bai Qi is making the Yin Qi, which is important to make the Wei Qi. Okay, can we get a copy of these notes? Well, these notes here are already posted. The other notes are on my website. What I gave to the Acupuncture Council has more discussion of all the formulas, but they're for people that custom prescribe. They're not, there's some default to products, but it's not as detailed. You know, Ganmaling is out of stock. Well, Ganmaling is made by a lot of companies. If you go back to my list here, if you go back to my list, here's the Ganmalings. I mean, a lot of people have it. Golden Flower, Dr. Shen, Khan, Plum Flower, Herbal Times, so on. And then there's other formulas that are similar. I gave a key. You'll see the key is on these handout notes. Cinnamon is antipyretic. Will this make it as problematic as ibuprofen? No, it's not near as strong as ibuprofen. No, don't worry about it. Don't worry about it. The amounts we're using are so small. You know, if you give a 100-gram mixed herbal bottle and maybe what, 5 grams, 6 grams, 5%, 6% is Guager, it's nothing. It's nothing. And if you want to substitute for ibuprofen, use jianhuang, curcuma. Okay. Yeah, ibuprofen's always a problem. It's always a problem. You don't want to use ibuprofen or Tylenol in high fevers. It just suppresses it and then it comes back again. You want to kill the virus. Fever is due to virus, to heat toxins. You kill the heat toxins, the fever goes away. Okay. Oops. Now, here's the herbal company code. So here is the other important man-made products that are antiviral. The ones with the asterisks are the ones that I like. I have one called Clear Toxin. It's out of stock presently, but it'll be back. I have one called GZQ. We do have, but all these other ones, there's a lot from 7 Forest. You have Petrinia 7. You have Paris 7. You have Ilex 15. All these are 7 Forest products, Chrysanthemum 9. Then Golden Flower has Viola Clear Fire. So all these are good anti-heat toxin formulas. Here's my herbal company codes on page 24. Okay, I'm not going to go into the E-Lotus formulas. They just have the formulas, which you can look at on your own when you download. When they mention ephedra, well, you just can't put it in. Okay, so then the question is, well, what did I do? So I gave Kate this formula. It's based on the lung clearing formula that the Chinese recommended, okay? So we're going to build Wei Qi with Baiju, and we don't have Huang Qi in here. Guager, disperse, Chai Hu Banqia, Huang Qin is a Xiao Chai Hu Tang. Ilex Balangan is one of the strongest antiviral herbs, so I have that. Other herbs are to descend dampness so that there's no damp accumulation. Baidoko, Tongsao, Zheshir. You'll see that they'll use Cao. Hard to get Cao. Cao is one of the Amomum families, so you can substitute Baidoko or Shaoren for Cao. Amomum and Cao. When you see that in some of the formulas. Baidoko is cheaper than Shaoren, FYI. Okay, this is what I gave her. And I gave that to her, and then she took it. And her symptoms did not get worse. They got better, but then came back again. Now with more chills. Her asthma got worse. The fever went away, cough went away, still some tightness in her chest, but it's down 75%. She occasionally gets digestive queasiness. Her smell is definitely diminished, but her taste is better than it was on this formula. I talked to her today. This is just from today. But she needed some more asthma medicine. So I gave her a formula for asthma back in the day, and she had some, and I said, take that right now. Yeah, so that's what we gave her. And you can see these on the notes. Her mother, I gave something pretty similar, some herbal substitutions because she had more lung issues, but the same idea. So these are the formulas I gave her. All right, let's go back to questions. Do you suggest that asthmatics increase their dose of asthma medicine during this time? Well, it depends what you mean by asthma medicine. If you mean Western pharmaceuticals, which is basically, Pulmicort and albuterol, well, they're going to know how to adjust that to their condition. If it adjusts, they can just raise it. Now, I have no problems with albuterol. I don't think it's harmful. Speeds you up a little bit, but nothing too accumulating. However, Pulmicort or any of the other steroid asthma medicines, if you take it every day, you're going to accumulate a lot of steroid. And that steroid is not good for you. It's just not good for you. But if you're talking about Chinese herbal asthma medicine, well, that's what I did with her. I told her to go back on the asthma formula that we had for her because she thought that was very successful. So right now at this moment, because I just talked to her before this talk, is she'll go back on the same formula, this lung clearing formula, and she's also on the asthma formula. What I'm having her do is having her take the asthma formula once a day, the other formula twice a day. Is adding watermelon frost is great for sore throat. I mean, it's amazing. It's an amazing, amazing product. Shishuang something. Yeah, it's great. It's great. Ask me how the Chinese figured out how to get that medicine. You know how they get it? They take a watermelon, they take out the fruit, they pack it with salt, and they hang it in a mesh net in a dark, moldy place. And the salt pulls in all the moisture from the rind, but on the outside, this black frost is produced, and it's very antimicrobial. It's excellent for strep throat. It's excellent for infected wounds topically. So yeah, I love watermelon frost, but that's for really raw sore throat. You got to ask about the sore throat. Is it just from dryness? Is it hard to swallow? If it's really bad, then definitely go to watermelon frost. I don't know what surotide is. Can you speak to the theory that some people get sicker? This is from Jen. Can you speak to the theory that some people get sicker from a really intense immune response, also attacking healthy cells in addition to the virus? Personally, I cannot speak to that because I don't have any knowledge of that. I do know that in a typical flu, the death rate is usually reserved for people over 65 years old or under 12 months. In the Spanish grip of 1917, 1918, most of the people that got it were between 15 and 30, 15 and 40, the healthiest persons. And they decided later that the virus actually entered the T cells. So if you had lots of T cells, that's where the virus is replicated. Now, the Spanish grip was so severe, much more than this coronavirus, you could be healthy and dead in 24 hours. That was a very common sequence for the Spanish grip, the Spanish flu. So in that, it went into a younger age group. Now, this virus has mostly killed old people. The young people that are dying of the corona, I'm curious, how many of them vape? How many of them smoke cigarettes? How many of them smoke pot? All three of those things are going to injure the lungs. So I would be very curious about all these millennials that are getting hospitalized or even dying if they're vapors, if they're pot smokers, if they're cigarette smokers. But as far as some people get sick easier because they have a strong immune response, I could see the logic in that. Children have really strong reactions when they get a common cold. They get high fever and really runny and really coughy, and then they get better much faster because they have a very robust immune system. So I don't know. For patients who take Zyrtec to clear postnasal drip, would you recommend they stop and we add something like pimencan? Yes, you can always use Chinese herbs instead of over-the-counter medicines for sinus and for allergy. But will it hurt them? I don't know. I don't know. I don't know. I just don't know. What product is that for the throat? It's called watermelon. Amy, what product is that for throat? That is watermelon frost. You can get it from New Herbs. Okay. From Xiao Rice. Is this Shi Gua Shuang? Yes. Shi Gua Shuang is the main ingredient of the medicine called watermelon frost, but it's only 50%. They combine it with Shurgan, and they have other herbs in that formula. What are your thoughts of peapod gout for sore throat? I don't know. I mean, peapod gout is for the lungs. This is from Jacqueline. Peapod gout for sore throat. I think with sore throat, anything that makes you feel better is good. Zand has a product called Herbal Mist, which is tree tea oil. And it's good. Anything that takes the edge off sore throat is good. But if it's a bacterial sore throat, then you definitely need watermelon frost. And you also need a couple medicines like Huanglian, Jiedupian, or better is Huanglian Shangqing, upper clearing. Huanglian Shangqing, which is a pill for that. Okay, or even Puji Xiaodu will work if it's bacterial. But most of this is viral. So the Puji won't really be that effective. The Huanglians won't be that effective. Okay, I believe she was referring to the cytokine storm that people are experiencing. The cytokine storm. Now this is interesting. I had seen a very good article on melatonin for the cytokine storm. It's an article that has been circulating by Chinese on why melatonin will really help the cytokine storm. Taking bigger doses than you think, like 10 milligrams a day. It's a Chinese article, it's a Chinese scientist who wrote it. And then the other thing that happens that is helpful is that people will lose a lot of potassium through their kidneys in the cytokine storm. So they need to supplement with either potassium or electrolytes. Okay. Now the cytokine storm, this is a big deal. Cytokine storm means that your body hits the infection with interferon 6, which is meant to attract other healing agents to the site of the infection. But if interleukin 6 is too much, now you're going to have the so-called cytokine storm. It's usually interleukin 10 that shuts down the storm. So the question is, how do you promote interleukin 10? Well, that goes back to your personal strength of Wei Qi and kidney Qi. So boosting interleukin 10 is a slower process. So you really want to sedate the storm. So there are other methods that functional doctors use to calm that down. I usually just go for straight liver detoxification. I feel like most cytokine storms can be mediated by treating the liver, opening up the liver, moving qi, moving blood, clearing heat. So formulas like Chai Hu Shugan San, formulas like Xiao Yao San. I have a liver formula that detoxifies, that just regulates the liver to reduce the cytokine storm. And the reason is all that debris is going to end up in the liver. And if the liver gets overwhelmed, the storm does not abate. But now I'm looking at, 10 milligrams of melatonin a day. Jamie, with the formulas presented, is there any caution that should be taken for deficiencies? This is always the issue. If you have deficiencies and you're fighting a toxic heat or cytokine storm, you need to support the deficiencies. And you have to ask yourself, what are they? And there's only 4. There's qi, there's blood, there's yin, and there's yang. And so which one of those four is this person really weak in? And don't be afraid to give them tonics. Don't be afraid of driving the pathogen in, because the pathogen is already in. It's a blood-borne, lymph-borne toxin. This is not a wind progression from exterior to interior. These viruses, they bypass that. They didn't get the memo. So they're systemic. So you don't have to worry about driving the pathogen in. The pathogen is already in. So that's why we can boost with Huang Qi and Baiju. If they're very yin deficient, boost the yin. If they're pre-existing yang deficient, boost the yang. Don't worry about the warming effects. It's okay. Spleen deficiency, but most people are going to burn up their qi really fast. A fever burns qi. In my feeling, the best qi tonic, royal jelly. I don't have time to talk about it now, but you can look into it. Royal jelly is probably the best spleen qi tonic there is. So when people are just burning up all their qi with fever, royal jelly will help. The Chinese used to give ginseng, renshen, but I think it's too hot. So we'll use Taizishen. We'll use American ginseng in those kind of fevers to boost the qi. But fever itself will deplete your qi. All right. Jack, what will be our focus to those patients who recover? Well, you can look at John Chen's recovery formulas is a good way to look. Cannabis is shown to reduce inflammation. I don't agree with that. Cameron, hello, Cameron. Can loquat syrup be used as daily preventative? No, it's not going to do anything. No. Some people, David, elderberry because of recommending against elderberry because of increasing cytokines. I don't know about elderberry. Natalie, are there substitutions for pregnant women? No. The only herbs you have to worry about in pregnancy are herbs that break blood stasis, not move blood. Danshan and Bai and Shirchow are fine, but the break stasis herbs, Rushian and Moyao and those heavy ones, Sanlong. So that group of the harsh purgatives, the harsh break stasis you don't give, and the purgatives you don't give. Outside of that, you can give anything in pregnancy. And that's the truth. That's my truth. That's what I believe. Okay. All right. So we're sort of at the end of our time. I really appreciate this discussion. I think it was lively. I had fun. I just want to point out that a lot of what I have to say about Chinese herbal formulas is in this book, and it's not that well distributed. If you don't have this book, it's a fun book. We're highlighting 200 formulas, why they work, what my clinical experience has been with, who should use it, when, how. You can get this book from my site. I appreciate talking to you, and I appreciate very much Jack Miller extending this invitation. Look at John Chen's material. He's always at the top of the game. And I'm glad you all enjoyed this. Thank you very much.
Yeah, thanks everyone. We will post the recording of this on our blog and on our YouTube channel. Jake, thanks a million. I hope your patients get well. I hope you and Dominique and your puppy dog stay really well. And I look forward to seeing you all soon. Thanks everybody. Signing out.
Thank you.
That was great.